Hi, Mike Gibson coming to you live from SCAI 2017. I'm joined this morning by Jeff Davis. Welcome, Jeff. Rena Silver. Welcome, Rena. And of course, Bernadette Speiser. Welcome, Bernadette. So often, people perceive these professional societies as doctor societies, but it really, taking care of a patient is a team effort. I mean, there's, one doctor in the room, but there's a lot of nurses and radiation people in the room. Talk to us about the part of SCAI that's dedicated to all those other members of the team.
Sure, be glad to. The cardiovascular professional membership category of SCAI really enables the nurses, cardiovascular technologists, physician assistants, the entire team to come together as their own membership category. The beauty of that is that we've got a seat at the table with the physicians, and really the heart team approach is the wave of the future. It's what we're doing now. It's a team approach. And we're only as strong as our weakest link. And by linking together with the physicians through this membership category, really allows us to work on initiatives such as advocacy, education, things of that nature. So it's an incredibly valuable membership for the entire team of cardiovascular professionals in the cath lab.
So Rena, it's been here for 2 years now, or how many years has this part of the SCAI been?
2 years that nurses, RTs, RCIS have been able to join the membership of such an excellent society. Been attending this meeting for 20 years, and it's a privilege now to be part of a society that's focused on providing excellent care to interventional cath lab patients that we all care for every day.
Yeah. So Bernadette, what are some of the sessions that are going on that are dedicated to the CV professionals?
Well, we have a CVP professional meeting area, and through that we looked at the top topics that nurses and technologists would be interested in. And through that, the three of us have sat down and looked at different areas of expansion of education, and also looked at areas where we feel like the nursing and technical staff can learn the most from. New innovations such as the Watchman, left atrial appendage, TAVR programs, where there's not really formalized education for the nursing and technical staff. We have used SCAI as a jumping board for us to be able to network with our CVP professionals as well.
And what do you guys have going on in terms of advocacy for CV professionals?
That's a great question.
In certain states, there's legislative initiatives that actually can limit the scope of some folks, especially cardiovascular technologists that literally have education credentialed. There's some limitations imposed by some states. So that's a huge advocacy issue that we're working on now.
Of course, there's the meeting, but then, how do you disseminate all that's going on at this meeting to your members? I mean, they may not all be able to make it here. What are you doing in that regard?
Well, we have a website that we're getting ready to launch. We do have names and emails of our members, and through our website, we're going to start blogging some information that's going on. We're going to have forums in which staff can call in. We're looking for a standardized approach for many of our things because a cath lab procedure is a cath lab procedure, and when you're writing it thousands of times throughout the United States, it's really difficult, especially for new managers and new staff to come on board to start from scratch zero. So some of us that are a little bit more experienced in the field want to share our expertise, and so having that forum is going to be really important for us.
Now there's the boot camp for the young guys who are or women who are gonna run a cath lab. Do you have a boot camp for CV professionals to kind of learn the ropes?
We do. We have the CVP sessions that's running half a day this afternoon.
But for the managers to learn operational things?
And it's more patient-oriented, clinical versus management. There's some overlap, but and then Saturday with the fellows, hands-on, we're partnering with them to do the session Saturday.
Well, Jeff, I think you said it best. It really is a team effort, and the lab is only as good as the weakest link when you're caring for a patient. So I'm thrilled that SCAI has recognized all of your efforts in this very clear way by forming a sub-society dedicated to CV professionals. So good to see. Thanks, guys, for joining us here.
Thanks so much.
Thanks to all of you for joining us here live from SCAI 2017.